Welcome back. If the thousands of confirmed cases of COVID-19 turn into millions, how will our healthcare system manage? The steps we're taking, like social distancing, are all an effort to flatten the pandemic's curve so that hospitals aren't overwhelmed. That is why this flattening of the curve is such a priority. Joining me now are Johnny Spizo, the president of UCLA Health, and Dr. Peter Slavin, the president of Massachusetts General Hospital. Welcome to you both. Let me start with you, Dr. Slavin, about the things that Mass General is doing. When are you preparing for what is going to be the peak of this curve, whether it's a mound or a spike? Is this coming in days, weeks? When do you expect it?
Good morning, Chuck. This is something that places like Mass General and hospitals around the country do on a daily basis on a small scale. We've been preparing for disasters for over 100 years, and for this particular one over the last two months. We're taking a variety of steps to get ready. We, like other parts of the society, are promoting social distancing, asking our staff who can stay at home to stay at home, canceling elective surgery, and trying to do as much outpatient care through telemedicine, particularly for vulnerable populations. And we're training our staff and getting ready to engage in this difficult challenge that lies ahead.
Do you have a time frame that at all that your experts are telling you based on what they think's happening in New England?
We think that the next week or two are going to be critical. We've begun to see cases in this area, but we expect them to rise dramatically in the coming weeks.
Johnny Spizo, you've had, the West Coast has been dealing with this a little bit longer than the East Coast. What have you learned over the last 6 weeks that tells you what we should be expecting over the next 6 weeks?
Well, thank you for having me. I want to first start by saying this is definitely an unprecedented time for healthcare systems in our country. But Chuck, I want your viewers to also know the remarkable effort that our staff are making around the clock to really prepare and implement our emergency preparedness plan for the COVID-19 outbreak. And all of this is really consistent with our mission of an academic health system to really treat the most complex injury and illness that we see with our team of experts, to really train that next generation of healthcare professionals on how to face these outbreaks, and to conduct that leading edge research and discovery that hopefully will lead to more cures. So we focused on, in addition to all the things that Peter mentioned, our big focus has been how do we establish surge capacity, recognizing that most of our hospitals are full. So our efforts have looked at really how we can create additional places to care for patients. If you go past our emergency department now, you'll see tents erected in the parking lot that allow us to increase emergency department capacity. Throughout our 180 clinics throughout Los Angeles and Southern California, we're encouraging telemedicine visits so we can create additional capacity there. We set up a satellite drive-through testing station. We were fortunate at UCLA Health. Our virology lab was one of the first to be able to start testing and doing our own tests that really save us time. We're hoping to continue to increase capacity, and having that drive-through area allows us to really contain patients from coming in to our main hospitals where our most sick patients are.
Dr. Slavin, it seems as if the thing we keep hearing about, respirators and ventilators, respirators in this case meaning the healthcare equipment essentially that healthcare workers need to treat folks, and of course ventilators because if it gets really, this is one of the things with the breathing issues for those that are elderly. What are your concerns? Has the federal government stepped up enough on this front?
Well, my concerns is I think we need to think about this in almost a warlike stance. My concern is that we have millions of healthcare workers around this country who are prepared to do battle against this virus, but I'm concerned that there are at least a couple of areas of supplies that they need in order to fight that virus as effectively as possible. One is the testing that we need, and Dr. Fauci commented on that, and I hope indeed that private labs are going to ramp up testing. We've started at Mass General Brigham to do our testing as of yesterday. But we also are very worried about personal.
Why was it yesterday? Why wasn't this 6 weeks ago? Can you help explain to viewers why your lab, and I talked to Johnny's about this earlier as well, I know they got online last week too. Why did these private facilities and university facilities take so long to get online?
Well, it was just the day before yesterday that we got regulatory relief from the FDA so that we didn't need to jump through all sorts of hoops and prove that our testing was as accurate as possible. Certainly the testing is accurate, but the FDA relaxed its regulation so that we could begin testing immediately. My other big concern is personal protective equipment. Even before the most significant battles lie ahead, our supplies are low. I hear from hospitals around our region and around our country that their supplies are low, and we need the federal government to engage in a Manhattan Project to get industry to create surgical masks, eye protection devices, gowns, so that our healthcare workers can engage in this battle. We wouldn't want to send soldiers into war without helmets and armor. We don't want to do the same with our healthcare workers.
And Johnny Spizo, last question for you. One thing the federal government hasn't done yet that you'd like to see them step up and do?
Well, again, I think I'd echo what Peter has mentioned about supplies. We really have to make sure we have the personal protective equipment to keep our healthcare providers and our patients and our families safe.
Johnny Spizo, Peter Slavin, Mass General, UCLA, both coasts. Good luck over the next couple of weeks and perhaps couple of months. I know we're all hoping you can handle this surge capacity. Thank you much. For the latest on the coronavirus,